All right. Well, welcome everyone to our third equine health webinar in our 2022 Equine Health Series. These webinars are brought to you in partnership with Michigan State University's College of Veterinary Medicine and My Horse University, an online horse management program based in Michigan State University Extension. During the presentation, you can use the Q&A tab to type in questions and press send. If you are joining us from Facebook, please type your questions in the comments section. If a question isn't answered right away, our presenter will field these questions at the end of the presentation. Now I want to introduce Dr. Julie Strakota, an MSU equine veterinarian and the lead in developing this webinar series. Julie is going to introduce our presenter for this evening.
Wonderful, thank you. I am so excited and honored to be able to introduce one of my mentors, Dr. Hal Schott, who will present Equine Neonates, What Goes Wrong. So Dr. Schott received his DVM degree in 1984 from The Ohio State University College of Veterinary Medicine. He started his career with 3 years in private equine practice in Southern California. Dr. Schott subsequently pursued advanced training by completing a residency in equine internal medicine and a PhD in equine exercise physiology at Washington State University. Since 1995, Dr. Schott has been an equine medicine clinician at Michigan State University with a strong clinical interest in urinary tract disorders and endocrine disorders. Over the past few years, Dr. Schott has also developed a strong interest in providing care to working equids in Mexico. In 2017, he developed a 2-week clinical experience taking 8 MSU veterinary students annually to work with Mexican veterinarians and veterinary students to provide veterinary care to burros, mules, and horses in rural Mexican communities. Welcome, Dr. Schott.
Well, thank you, Dr. Strakota, and thanks, Chris Kelly. It's a pleasure to be with you tonight. It's not so nice outside in Michigan this evening. It's a rainy third day of spring and about 45 degrees. So hopefully better off listening to the computer talk here this evening than being outside with your animals. I'm going to spend the next little bit with you talking about equine neonates and talking about, unfortunately, some of the things that go wrong. We'll start out with some general ideas that I have for you, and then we'll finish the second half going through a couple of cases to illustrate how some of these guys go. So you can see from these pictures here, some of these guys don't look like they're doing all that great. This guy over here is a little slow to get going, what we call sort of the dummy foal syndrome. This little guy here, this cute little appy, unfortunately lost his mama during the birth process, so he is an orphan. And over here, we can see that this little foal has a pretty big hock. And he's got some localized infection, and that's one of the problems we can see, which you've probably all heard of, joint ill. So I just wanted to start off with one slide showing you some numbers that we've seen here over the years at Michigan State. And this is actually nearly 20 years ago, but it holds true today. And what you can see here is basically in the green bars, the number of foals that were admitted to Michigan State University less than a couple of weeks of life. And what I wanted to show you basically is if you drop a foal off here with some medical or surgical problems, what's the likelihood of it going to go home and do okay? So the green bars are our total numbers, and we ranged between about 60 foals up to a high of about 80 foals back in 2004. And obviously during the last few years, it dropped off a little bit breeding in Michigan. But last year, we actually had about doubling of our foals, again, up to about 55 or 60. So breeding is certainly coming back. I guess you guys had more to do with your horses during COVID and some time. So we are seeing foals come back. But pretty consistently over the years, the yellow bar is the percentage of our survivors, or the number of survivors. And along the bottom here, we can see these numbers are our survivors. And overall, if we look at this, there's about a 75% overall survival. So about 1 in 4 foals that comes to us, unfortunately, we are not successful with, but about 3 out of 4 we are. So that's sort of nice to have an idea of what the chances are if they have to come to the hospital. You can also see these red bars. They're slightly dropped numbers, 1 to 2 or 3 foals a year. And that's what we call long-term success. And so some of the survivors that are sent home still can develop some complications. And probably the most common complication we'll see is a smoldering joint or bone infection that may not be apparent in the first week of life, but starts to become apparent after 2 or 3 or 4, even 6 to 8 weeks. And unfortunately, if we get those kind of complications, the athletic potential is not very good and the quality of life is not very good, and euthanasia is often performed later. So we do have a small percentage of what we call not successful in the long term. So I just wanted to go over a few rules of foaling that I want you to really always to remember. And that is, once the mare's water breaks, and that's the rupture of the chorioallantoic membrane, something should happen within that first 10 minutes. And that means the nose and the feet should start exiting the vulva. The mare should be laying down and actively pushing. And that foal should be out in 20 to 40 minutes. The mare has a very fragile placenta, and the oxygen supply to the foal is cut off pretty quickly. So anything that prolongs this process can result in oxygen deprivation to the foal and tissue damage associated with that. So this is really probably the one true equine emergency, is when a mare foals and is having difficulty. We call that dystocia, difficult birth. That's really when someone needs to get some attention right away. So call your veterinarian if something isn't happening within 10 minutes. And what you can do in the short term while they get there, hopefully in time, may be to just get the mare up and hand walk her to try to prevent her having active abdominal contractions. If you're within 15 to 30 minutes of a hospital, you just get the mare on a trailer and call and say, we're on our way. Really, really important. And that foal should, once it's out of the mare, it should stand within an hour. It may need minor assistance, but the problem is we all want to do something. And so we all often get a little bit more involved in this process than need be. So I recommend you really try to minimize interventions in the first hour after foaling. Stay outside of the stall. You can video all you want, but being in there between the mare and the foal sometimes is not helpful. The second rule then is, or the third rule is, that foal should nurse within 2 hours. Again, it might need a little minor assistance getting its head in the right area. And it's okay if the foal nurses the shoulder. It's okay if the foal nurses the elbow or the stifle first. It'll find that. And usually it should find that there within a couple of hours. Okay. If that foal has not stood within an hour, and if that foal has not nursed within 2 hours, those are sort of alarm bells that should go off. And that's when we recommend you call and get some help. And the way I sort of think about that is, you can pay the vet now to get out there early, or you pay a lot more money if you wait too long and get further behind the 8 ball. So early intervention and help is really critical. Okay. Sort of over the years, I've watched people do lots of things to foals. And, again, the feeling is I have to do something. Well, not necessarily. And so, giving a foal an enema to help it pass its meconium, it's commonly done on farms, but it rarely is necessary. Certainly a small percentage of foals, very small, will get a little bit of problems passing their meconium, and they may need some help with some enemas. But one of my daughter's favorite movies when she was growing up was Spirit. And certainly all the baby foals that are out there in the wild in Wyoming and Nevada, I don't think very many of them get enemas after foaling to get rid of their meconium. And so nature does things pretty well. So, this is something that, you don't really need to do. Well, if we don't want to do that, we want to prevent infection by this umbilical route. So we call that naval ill, and we think of that as being an avenue for bacteria going all the way through the bloodstream. We call septicemia. And so if a little bit helps, sometimes the result is we give a little bit more than we need. And sometimes we use a disinfectant that is stronger than needs be. So this should be a very dilute betadine or chlorhexidine if you're going to do it, not strong tincture of iodine. That strong tincture of iodine is the 7% iodine that stains your hands. I'll just show you here. This is a picture of a foal that did end up having an umbilical remnant infection that we had to go to surgery and remove it. And so when we were prepping the foal's abdomen and clipping off, this foal had all sorts of areas of scalding. These are burns from this aggressive type of naval disinfection, okay? So again, really, it's not even needed in most healthy foals. Little Spirit didn't have his navel disinfected. And if you want to pursue it, we again use a dilute solution. This is a chlorhexidine solution that we actually dilute with Sera water, and use some sort of closed device that you can put snugly up around the belly button and shake it on there where it doesn't go all over the foal's abdomen. And again, we just really encourage to let the mom bond with the baby as best as possible. Okay. It is important when the foal's first coming out to make sure that this amniotic membrane, other membranes are broken and they're not over the foal's nose. So if you see a foal coming out and the membrane hasn't broken, we do want to go in there and bluntly just tear that off and then get it back. But then pretty much let the foal be with mom. Some people advocate the idea of imprinting, to try to get the foal to really bond with people. And they'll end up actually doing a little bit too aggressive imprinting. And we've seen a few foals over the years coming in here that have problems bonding with the mare and end up with some medical problems just because of too much human intervention. So again, mom's trying to do her job here. Let her do her job. Better off outside of the stall watching for this first period of time to make sure things are okay. Now, I'm not against early training of foals, and actually really like it when clients halter break their foals and help work with them to pick up their feet and do things like that, because it's much easier for us to work on them as veterinarians than a 9-month-old weanling or a yearling that's really never been touched but just been turned out. Those guys are pretty tough to work with. So I'm not against early training at all, but a little bit of the practices with imprinting I think might go a little bit far. And I found this picture on the internet that I got a little bit of a chuckle out of, putting a plastic bag over your foal. And I just was thinking, would you do this with your 1-year-old toddler? Would this be something you would do, thinking that's a healthy way to raise your kid? And if you think about it that way, I'm not so sure we really need to be putting plastic bags and potentially scaring these little guys. So I certainly basic halter training, picking up feet, teaching them about lead ropes, that's all good stuff, but I caution you from going a little too far. Okay, so what goes wrong? The first thing that we worry about is infection. Okay, and it's been called navel ill because you think about it going in through that umbilicus, joint ill because bacteria can end up in the joints and cause infection there. And the term we talk about it as doctors is neonatal septicemia. Neonate typically refers to the first week of life. Septicemia means bacteria are traveling through the bloodstream causing clinical disease. And the problem is those bacteria can travel all throughout the body, but we don't always know where they end up and set up complete housekeeping for the initial couple of days of life. Also, even though we worry about the umbilicus, what's really important to recognize is the intestinal tract is actually the most common route of infection. So bacteria are going to be ingested and go in where they're absorbing colostrum. Bacteria can be absorbed into the bloodstream directly. So this is actually the most common route of infection, not the navel. And then these bacteria can spread through the bloodstream, as I've already mentioned. The clinical signs that we tend to see in these guys in the first 2 or 3 days are really what we call non-specific or generalized. They're just a bit dumpy. They're maybe not able to stand up as well. And if they get up, they walk around with their head hanging a little bit and they go over and try to nurse the mare, but they're not really doing that effectively. Okay. Now that doesn't say I have an infection. That just says I have a problem. Again, it's a non-specific thing. When we think of infection, we typically think that one of the things we should see is a fever. But because these guys are small and oftentimes born in the time of year when it's a little bit chilly outside, and thirdly, not getting enough nutrition, it's more likely that we find them with a low rectal temperature than having an actual fever. So fever is not a good sign to say that there's an infection here. If a fever is present, it certainly supports an infection. And then we'll look a little closer, and here we can see some membranes that aren't the normal pink color, and we look for little spots of blood or hemorrhages here to also support that maybe there's some damage in the bloodstream and some infection going on. Over the next 3 to 4 days, sometimes then that infection can localize. And this is the same picture of a infected hock joint that I showed you on the very first slide. And this is certainly evidence that there was septicemia, and that is now localized into this hock. It can localize in the lung and cause pneumonia. It can cause damage in the intestinal tract itself and see some diarrhea and maybe some bloating after nursing where they're not effectively absorbing the milk. We can see umbilical infections for sure. And again, the bones, in addition to the joints, can get infected. So osteomyelitis means infection of the bone itself. And unfortunately, sometimes it can be pretty bad, and we can get the central nervous system and the brain and the spinal cord get infected as well. And that's called meningitis. And these animals are often quite dull and may develop seizures. And this is very, very difficult to treat. So we hopefully don't have that. Fortunately, it's pretty rare in our sick foals. So again, with infection, if it's happening by absorbing bacteria across the gut, the most important preventive measure is early ingestion of colostrum. Okay. And we want that first dose of colostrum in there in that first couple of hours. And a foal can typically drink about a pint, about 16 ounces at each feeding. So we like to get about 3 or 4 doses of this colostrum in the first few hours. And hopefully all of it is coming in naturally by nursing mom. But sometimes mom doesn't have that good colostrum and we can get problems there. So since the GI tract is the most common route of infection, we want to get this gut closed by feeding it. And so one of the things that's a little bit interesting about foals compared to, let's say, children, is that the gut is quite open, and that's open to be able to absorb these large molecules called antibodies that are in the colostrum. And those are absorbed across the intestinal cells, the lining cells. And soon as those cells ingest that, they close down to further absorption of the large molecules and only absorb the small molecules like the sugars and the fats that are in the milk that are there for growth and nutrition. So we really want to close that gut. And one of the things that is most disheartening to me is when I see a foal that comes in here at 24 hours of age and they say, well, it's maybe tried to nurse a few times, but really we haven't seen it effectively nurse. And that's just a huge red flag that, wow, we've given a lot more time for the bacteria to get into this foal. Sepsis becomes much more likely. So if we don't have colostrum, if the mare is not producing good quality colostrum, maybe she leaked it out, or there's some mares that just don't produce good quality colostrum, we want to get something else in there to close that gut. If the foal is happy and healthy and suckling, but the mare just doesn't have good colostrum, but has good milk, we'll let it drink that milk. If that foal is not doing all that well, we'll try to get some other product in there. If we don't have mare colostrum, we can use cow colostrum. It's rich in nutrients, it's rich in vitamins and minerals, but the antibodies that are in the cow colostrum aren't really good for the foal, they're good for the calves. So it doesn't replace the antibodies, but it's pretty good otherwise. And if we don't have any mare's milk, when the mare's not making much, we can use some goat's milk or cow's milk. And we may have to have your veterinarian actually administer a dose of this by a stomach tube at 3 or 4 hours of age if the foal's not effectively nursed between 2 and 3 hours of age. But we really want to get that gut closed as quickly as possible. In addition, we'll have to provide some antibodies because if we're not getting the colostrum in by another means, and that's usually by an intravenous plasma transfusion, and they usually need 2 or 3 quarts of that to get adequate amount of antibodies. Okay. You'll find things on Google and the internet where you see this product here called foal colostrum oral gel. Well, that sounds great. But it's important to recognize that there are no commercial colostrum substitutes products available for horses. There are some for cattle, but not for horses. And that's because there's just not enough colostrum made. A mare makes usually just enough colostrum for her foal. Now, on the larger breeding farms, they're pretty strategic. If they're going to have 50 foals, what they'll do is go in there and milk off maybe 2 ounces of colostrum from a foal that's doing quite well and a mare that's producing quite a bit. And then they'll bank that and freeze that. And that frozen colostrum is as good as gold. And you keep that for several years frozen if you ever need it. And if you have a farm, again, with 50 mares and you can maybe do that off 10 or 12 mares, you might be able to get yourself a pint or 2 of colostrum frozen that you can use on a foal that needs it. And actually, the only place I've been able to find that actually does have frozen colostrum available to purchase is at Haggard's Pharmacy in Lexington, Kentucky. So Haggard Medical Institute down there will sell it at $130 a pint. It's really interesting that they get that by donations of small amounts of colostrum from the large farms in Kentucky. So those farms are willing to share it. And then Haggards test the colostrum, make sure it's of good quality. They'll aliquot it out and freeze it. And then all the colostrum they sell, actually all the profits from that goes to a local horse charity. So they're really trying to just help out other foals in the area, but they're not trying to make a profit off of it. They're just trying to help out foals. Unfortunately, we don't have that many farms up here in Michigan. We don't have a similar program. And if we have frozen colostrum here at Michigan State, we have about enough for one foal that might come in and need it during the season. So it is a precious commodity, and you can't go out and just buy it on the internet. Okay. When we do have infection, our survival decreases, and that's not surprising because we have potentially more organs that can be affected. So when we look at our overall horse numbers, with sepsis, our survival decreases to about 60% overall. So we want to do what we can to prevent sepsis. And that usually is a combination of making sure there's good colostrum or plasma for antibodies. And then if there's any concern in that foal in the first few hours of life, we typically start them on prophylactic antibiotics. Hopefully they're not needed. Prophylactic means preventive, to try to prevent any evidence of infection. All right, so we're going to move into non-septic or non-infectious conditions, okay? And I'm sure that everybody out there's probably heard of a dummy foal. Well, when we talk about dummy foals as doctors, we talk about it as birth asphyxia. Other terms that have come and gone over the years are neonatal maladjustment syndrome, hypoxic, so not enough oxygen, ischemic, that means not enough blood flow, encephalopathy to the brain. So the brain's just not getting enough nutrients, and so we get some brain damage. And so that turns into neonatal, again, young foal, encephalopathy, problem in the brain, and very easily just to call it a dummy foal syndrome. So one of the ways to think about this is what would happen to you if you put a plastic bag over your head? Now, I don't advocate you doing this. And I was actually a bit amused when I went on Google Images yesterday to look for an image of people putting a plastic bag over their head. And there were lots of them. And I'm like, you crazy people, what are you doing? So I selected this one that was a cartoon I thought that was probably the most appropriate to share with you. Well, if we put a plastic bag over our head and we stop or can't breathe, the oxygen level in our blood is going to go down. The carbon dioxide level is going to go up, and the acid level in our blood is going to go up, and that means we drop what's known as the blood pH. This triad, or these three abnormalities, are the definition of asphyxia. And when we started, I mentioned how important it is for that foal to get out within 20 to 40 minutes, because the way the mare's placenta is diffusely attached to the inside of the uterus, as soon as those contractions start to occur, that detachment breaks apart and the foal starts to become deprived of oxygen. The CO2 in its blood goes up and its pH goes down. So the way I like to think about that is even the normal healthy birth process, it's a normally asphyxiating event. So it's as if this poor foal has had a plastic bag over its head for 5 or 10 minutes as it's coming through the birth canal. And not surprisingly, once it finally gets out and starts taking its first breaths and starts taking oxygen in and getting rid of carbon dioxide and normalizing its blood pH, what do you see that foal do? Well, it shakes its head around a little bit. It struggles to get up on its sternum. Then it struggles to get up on its feet because it probably has a little bit of a mild headache after going through that birth process. So anything that prolongs that birth process and prolongs that period of asphyxia can progress from reversible damage from just having a short period to more irreversible damage, where organs that rely on oxygen, such as the brain, the intestinal tract, the kidneys, the heart, can sustain some permanent damage and not be able to recover. So here's an example of a foal that had a little bit more severe problems and a little bit more prolonged asphyxia, and it had some of these twitches that were not very well controlled, and he ended up, you'll see here in a second, he goes from this sort of chewing motion to a little bit of leg motion to, unfortunately, a full-blown seizure, and that tells us his brain has certainly been damaged. And unfortunately, after a couple of days of trying to support this foal, we were making no headway and recommended that the foal be put to sleep. And when he was put to sleep, he saw in his cerebrum, or the part of the brain that controls these motions, there was some of the cells had died. And this is very sad when this occurs, but we do occasionally see this kind of problem when things go wrong. Okay, some of you may have heard of the Madigan squeeze for dummy foals. John Madigan is a medicine clinician out at the University of California, Davis. He's recently trying to retire, I would say. He's still in it, but he's been an amazing guy, and I've known him for a long time, and he's been one of my mentors over the years. And he just asks occasionally some off-the-wall questions. And one of the questions he asked was, why don't foals gallop in the uterus? Why aren't they just growing around there? As soon as they get out in a day or two, they can gallop around. So what keeps them quiet in the uterus? And what it is they have high levels of hormones called progestogens. And these act as a bit of a sedative in utero. So what has to happen is during the birth process, they have to signal for these progestogens, their production to be turned off. And that signal happens during compression in the birth canal. It turns off the production of these guys and they wane out of the system fairly rapidly. So basically the sedative is also taken away during the normal foaling. Sometimes this doesn't happen all that well. And the idea he had is, well, maybe we need to try to rebirth this foal, have a little reset or a repeat. And to do that, he basically has a couple of ropes around the chest. They squeeze that and compress this foal, mimicking repeat going through the birth canal for about 15 to 20 minutes. And the foal, when this squeeze happens, they just lay down there and take a nap. And then what you hope is that when you take the ropes off, this foal all of a sudden says, whoa, what was that all about? And wakes up and stands up and has basically had this reset, and these progestogens go down very quickly and they recover quite well. When this works, it's really great, but unfortunately, it doesn't always work. And so if we've had a prolonged birth process and we've had asphyxial tissue damage, this squeeze thing's less likely to work. Okay, but sometimes it can work pretty well if there's been less asphyxial damage and there's very little negative to trying it. And so we do try this on some of our foals in the hospital, and some of our referring veterinarians have tried it in the field with pretty good success, but sometimes it doesn't work. And so it's not something that's going to work on all foals that have a slow start. A few other non-septic conditions. We can have foals that are born a little bit early. Prematurity in the mare is defined as a foal that's born less than 320 days of gestation. And what we can see here is a radiograph of the front leg of a foal that was premature. And these are the carpus bones, or what you'd call the horse's knee. And you can see that there's not much mineral here. And these are very soft and fragile, both in the carpus and back in the tarsus, or the hock. So when we have prematurity, we have to get all the body tissues going, but we have increased problems with legs, developing crooked legs and crushing injuries leading to early arthritis that can tend to be career limiting in terms of performance. So it's something we worry about. And we try to protect those legs really well with premature foals. We can have some colic in babies. Certainly we can get the rare one that does have some meconium retention. I've even seen them have twisted intestines like we see in adult horses, where we have to take them to surgery. So colic can happen. Sometimes it's when they don't digest their food very well. They get gas distension in their bellies, and that often goes along with infection as well. Sometimes male foals will come through the birth canal with a very full bladder. Normally, foals actually urinate a little bit in utero. They pass some urine into their amniotic fluid, but the bladder will be variable in size when it comes to the pelvic canal. And if it's very big, we can sometimes see that the bladder will get this longitudinal tear on the top of the bladder as it's going through the birth canal. And then the foal doesn't urinate very well, and the urine accumulates in the abdomen, and we see abdominal distension over a couple of days, and some of the blood electrolytes get off, and we have a problem there. Fortunately, these usually can be fixed by surgery. We can get a blood problem where the mare's antibodies in her colostrum attack the foal's red blood cells. That's called neonatal isoerythrolysis. Happens probably in 1% to 2% of our foalings. And if we're worried about this based on the breeding of the mare and the stallion, we can actually test the mare's blood for antibodies a month or so before she foals to see if that's a risk. So that's something you may want to talk about with your veterinarian. We obviously can get trauma, fractures, and wounds. Oh, did mom step on the baby and that's why it's not acting very well? And that occasionally happens. And surprisingly, about 15% of normal, happy, healthy foals, when we take x-rays of their lung cavity, they actually have some rib fractures. And so thinking about all the compression that goes on, and that's not surprising, most of these rib fractures are non-displaced and heal on their own, but occasionally one can be displaced and puncture the heart, which is not a good thing, as you can imagine. And then there's a variety of congenital defects. Always want to check the foal to make sure its palate is complete. Here's a cleft palate, and if this foal is nursing its milk, it's not going to necessarily get swallowed all the way. It comes back up here and it'll run out its nose. So when the foal has milk coming out its nose, we worry about a problem like a cleft palate or a problem in the back of its throat. And for those of you who are in the quarter horse and paint business, you can recognize that this mare's a frame overo. And frame ovarios carry a lethal white gene. It's an autosomal recessive. So about 1 out of 4 of their babies, if you breed a frame overo mare to a frame overo stallion, will have this lethal white problem. And then this is an Arabian foal syndrome called the lavender foal syndrome. I actually saw one of these back in 1984, provided supportive care to it for 5 days, and I'll never forget the sort of underlying lavender sheen this foal had. And didn't know about it back then, but now I know that I was basically prolonging the inevitable. This foal was never going to live. So there's some genetic diseases that we can now test for on newborn foals to see if that might be a problem. What else can go wrong? I introduced this little guy here in the very first slide. He was an orphan. And if we look back over that 6 years or so of those foals I showed you on the first slide, 22 out of nearly 400 foals actually were orphans. So they lost their moms. And with orphans, there's some special challenges that we have. First is socialization. Oh, it sure is fun when they're this size. This was our neonatal rotation of students, and we brought the orphan foal out to hang around with us, but it bonds too closely with people, and they can end up with some quite significant behavior problems. So once this foal is 3 to 4 months old and is basically able to go off milk replacer, you want to try to find a farm that has some other weanlings that you might be able to introduce the orphan to let him, you know, go out and be a horse, get beat up by his buddies and learn how horses have to react and act so they don't get the socialization problems. Because they're raised on milk replacer rather than on natural mare's milk, we do see a little bit more problems in development of their musculoskeletal system with these guys. So I always warn clients that we might have more problems with their bones than a normal foal. Not a huge increase, but maybe a 10% increase. And then for some reason, probably again, since they're not on mare's milk, these guys just tend to look ill-thrifty from about 3 to 9 months of age, look a little bit pot-bellied, a little bit ratty. You might think they're parasitized. And slowly as they grow to a year or two, that sort of goes away. But these are the 3 things that I've seen with orphan foals that I worry about. Now, the good things, if we don't have infection with non-septic problems, our survival increases to about 80%. So 4 out of 5 foals go home. Again, if we think about only 3 out of 5 foals went home with sepsis, that's 60%. And that puts us sort of in the middle at about 75% overall survival rate. Okay, we're going to look at a couple things here on these guys. This is just a foal laying comfortably in a stall. I want you to look at its regular breathing pattern. Foals are going to breathe a little bit faster than an adult horse, but what we want to see is it's nice and regular, and that says that its brain is sensing the appropriate levels of oxygen, carbon dioxide. Now let's look at this guy. First of all, you'll notice that this guy's sort of in a bit of a discombobulated position. Most foals wouldn't lay there. And if you look at his chest right through here, I apologize to those of you who have slow internet connections and may not see these videos very well, but he just had a long period of time where he stopped breathing. Then he took a breath. Not breathing. Now, big breath. So what's happening is the carbon dioxide in his blood has to build up to a higher level than the average foal to stimulate him to breathe. So that says he's got some problems in his brainstem, and that's probably a consequence of birth asphyxia. So just really observing these guys and seeing what they look like helps us know whether or not they're doing okay or not. And then how are they nursing? So that's the sound we want to hear, right? Really good aggressive nursing in this little Clydesdale foal. Really latched on pretty well. If we compare it to this guy, yeah, it looks like things are going okay, right? He's up
Can
there.
we try letting go overhead? You're all right, it's your baby. Being nice.
Oops. He's maybe not quite as stable as the last one that could angle its head around and really get up underneath there.
You hear the popping? Could you? Maybe we could just do the ears. Yeah, that's
So this is another foal with some birth asphyxia, and it has an indwelling nasogastric tube or stomach tube. We're actually helping it feed because it's not effectively nursing on its own. See, it looks like it's got a little headache or whoa. So that's not right. All right, so with that, we're going to move into a case that I think will illustrate how we like things to go. This was a foal we saw back nearly 20 years ago, back in 2004. It was a 12-hour-old thoroughbred filly when it arrived at our hospital. It was born at 6 o'clock in the morning, and it was maybe about 3 weeks early, about a little bit premature, but it did not look terribly premature. It was the mare's third foal. She'd not had any prior problems. But a couple red flags in this gestation is she had premature development of her mammary gland about 30 days ago, and she'd been leaking milk for the past week. Okay, what's that mean? So typically premature development means maybe the placenta's not that happy. We might have some inflammation or placentitis. And this leaking of the milk for the past week says there's no colostrum left. So we're going to have to be thinking about an alternate colostrum source. The birth process or parturition was observed. It didn't appear to be any problems, but the foal was a bit smaller than expected. Maybe that placenta wasn't working so well and its growth was retarded a little bit in the last month or so. We call that intrauterine growth retardation. They come out a little smaller than expected. The placenta was passed 20 minutes after the foal, which is, we like that out, that's for sure. And the foal was initially vigorous and was able to stand after 3 hours. Struck out on rule 1 right there. Strong suckle, could not stand for long and nursed only shortly. Okay, so it broke rule 1 and rule 2 about not getting up within an hour, not nursing effectively within 2 hours. So clients, well, they called out the veterinarian with 4 hours of age, 10 o'clock in the morning. Its heart rate, its temperature, and things were all normal. It had a strong suckle. It had a little contracture of both legs, but it could stand with assistance. The placenta was actually a little bit heavy with some thickened areas, again, suggesting there had been some placentitis. The veterinarian suspected the dummy foal syndrome, hypoxic-ischemic encephalopathy or dummy foal, and tubed it with some milk and fed it. There was no alternate colostrum available right there. So they started it on antibiotics, gave it a tetanus shot, some vitamins, and they instructed the owner to stand that foal and nurse it every hour and to call if it became weaker. About 4 hours later, things aren't going all that great. It's a bit weaker. It did pass some meconium. The veterinarian was called back out, fed it again by a stomach tube, and referred it to MSU to get this guy a little bit more treatment. So when it came into us, it was weak. It could stand for about 30 seconds, but only with assistance. It's starting to get a little bit cold. Its temperature should be about 101 or so. Its heart rate and respiratory rate were okay. Its extremities were also a little swollen and cool, and that's something we sometimes also see with asphyxia. It wanted to suckle really well, but it couldn't really figure out where. Its heart and its lung and intestinal sounds were okay. Its umbilicus was a little thick but dry. It had, again, a little bit of contracture of the front legs. It was mildly windswept, and you'll see that on a video I show you in a second. And it had a little bit of entropia, and that's a turning in of the lower eyelid or a rolling in, and that damaged the cornea a little bit. And that green stuff there is a dye called fluorescein that shows us a corneal ulcer is developed in both eyes. And it was a little small, but 113 pounds. It was a big mare. You know, it looked okay, but again, the owner thought it was a little small. So we did some blood work, and we're not going to go through all this, but what I want you to see is all the blue numbers are lower than they should be. All the green numbers are higher than they should be. And if they were the same color as over here on the left, they would be normal. So there's a lot of abnormalities. And this IgG, that's the antibody level, that should be greater than about 800. So we don't have much of that, and it had not gotten really any colostrum, right? So we have that. So we have some problems. We have what we call failure of passive transfer of antibody. That's ingestion of colostrum giving adequate antibody. We have some infection suspicious by a low white blood cell count. And these kidney values are very high, and we're worried about a little bit of kidney failure. Okay, so we take a sample of its blood and actually put it in for bacterial culture to look for bacteria, but it takes us 3 or 4 days to get those results. So we can take some information based on the foal's history, our clinical exam findings, our early blood count results, and some other lab data like, again, the antibody level, the IgG, and the blood sugar, blood glucose, and combine all these up. And this is called a sepsis score to give us an early indication of whether the foal is likely infected. If the score is greater than 11, infection is likely. If it's less than 10, unlikely. This foal was 21, so it certainly supported sepsis. So we continued it on antibiotic treatment. Okay. To correct the failure of passive transfer, we gave 2 liters or 2 quarts of plasma intravenously, continued antibiotics, fed it mare's milk, gave it a little bit of fluids for the kidneys, eye medications, and monitored it very closely and attempted to descend it every couple of hours. We did dip its umbilicus every 6 hours because it was starting to become open again. We didn't want that to happen. And when they're recombinant sick, we will dip the umbilicus. But again, most normal horses don't need that, and observe it to see if it passes urine and feces. So after 24 hours, we've made some headway. This foal can stand for 5 minutes on its own. It's actually nursing a little bit when assisted, but its umbilicus did start to open back up and leak some urine. So we have to keep doing some local care there. It passed some more meconium, it passed some urine, it gained a couple pounds, and it was less dumb. And here's its first venture out of the stall.
Oh, good, Mommy. Oh, quick.
So not the smartest foal in the world. And this is this windswept appearance where its hocks go about both to the side. Well, that's from uterine positioning, and usually we'll outgrow that. So can't follow mom all that well. The good sign is that mom's still interested in this foal.
Come on, we're going back to bed.
And we'll head back to the stall. And here we are after another day. And we're really happy we came in the morning and the overnight text said the foal actually stood on its own once without assistance overnight. It started to nurse a little bit better. Umbilicus was leaking less urine. It gained some more weight. Its eyes were better. Lab data was improving. And importantly, no further complications had developed. So we decreased our supplemental feeding to every 4 hours from every 2 hours, letting it nurse more on its own. And here we are coming outside a little bit.
Careful on the hill if you trip about.
So certainly not normal yet.
Keep going.
But is starting the idea of following mom. This was early April in Michigan. Nice spring day, and you'll see in a couple more days we're having some snow.
Yep, come on back.
See that again, that where the hawks go off to the right, that's that windswept appearance. That'll recover. She says, well, I think I'm gonna maybe stop and pass some urine. She does. But clearly not attached to the mare as normally, but she's now passing urine normally, and we're no longer having it dripping from her umbilicus, so that's healing up okay. And here we are 2 days later. She's standing and nursing without assistance. Umbilicus is now dried up. Lab data is looking good. We actually did not culture any bacteria from the blood culture, but we don't always get the bacteria that are there. You can see it's actually cantering down the hall a little bit, so really improving nicely. So we decided to remove the stomach tube at this time, stop the eye medications. We're going to continue antibiotics because I told you one of our concerns is that we have potential of long-term bone problems. Here we are at day 7. This is the same foal, believe it or not. That's the same place that was nice and sunny the other day. But we all know we can get snow in April in Michigan, especially those of you in the UP that are with us. So really quite a dramatic improvement over this first 7 days of life. And this is what we like to see. So we discharged her on day 9. We stopped her antibiotics at that time. And our diagnosis was some placentitis that led to some hypoxic-ischemic encephalopathy, failure of passive transfer, some leg problems, probably had some mild sepsis, corneal ulcers, and a patent urachus or leaky belly button. Prognosis long-term is probably pretty favorable. These kind of foals have gone off and done quite a few different normal things in life, from show horses to race horses. And back about 20 years ago, her bill was about $2,300. Today, this would probably cost $3,000 to $4,000, something like that. Okay. So what went wrong? Some placentitis in the mare, a little bit of mild prematurity, maybe some hypoxic-ischemic encephalopathy, premature development of the mammary gland, supported the placentitis, lost the milk, leading to failure of passive transfer. And we would get some rapid deterioration without nutritional support. So what went right was prompt recognition of problems by the owner and an early referral when the improvement was not observed, and a little bit of luck. And I can't overemphasize here at the end that even though many foals go on and develop just fine and are just fine after birth, having a well foal exam about 24 to 36 hours of age, or even earlier, 18 to 24 hours of age, depending on when the foal is born, is really important for your veterinarian to detect early problems and to test the blood potentially for failure of passive transfer. Depending on the farm, 10 to 20% of foals will have failure of passive transfer. Now, not all of those get sick, but if we look at our sick foals that come in, more than 90% of them do have failure of passive transfer. And I think I'll stop there since we're at about 7:45. And I think there's a drawing of an award that's going to happen. I'll stop sharing my screen and turn it back over to Chris Skelly.